This is a nice example of a sort of middle-aged gentleman who had not terrible hair loss, but some thinning in the front. So he elected for a strip procedure. We did a little over 2,500 grafts, one session. And you can see how we basically got this back to exactly where he wanted his hairline. We tapered in on the temporal points. You see here how he's got his hair combed forward. Well, that was his effort to sort of cover that region. So obviously we turned that around and gave him a beautiful matching hairline. And, you know, this is exactly what he wanted. So he was very pleased.
I think I started losing my hair probably in my late 20s. It was really just kind of receding hairline. I think the rest of it started thinning out a little bit more in my early 40s. I honestly didn't really try much of anything. I never really did any medications or any shampoos or anything like that. I kind of was just fine with what was happening, not too worried about it. But there was a time where a friend of mine sent me a picture of I thought two different people. And he said, no, that's the same person just before hair transplant and after hair transplant. I was like, what? So that's the moment I think I was like, oh, this is actually real. This actually works. He wanted me to start on the medication first to see how I responded to that. So I did the medication, and I think the response was pretty good pretty quickly. And then it was decided that the surgery that he recommended was the one where they take part of the back, they take part of the scalp, pull your hair follicles from that. He thought that would be the best option for me. So that's what we decided to do, was to do that surgery that way. And so we set it up for November of 2022. I was obviously very nervous, because you're trying to decide, is this really going to work? Like, am I spending this money? Is it going to be worth it? What's happening? Is it going to hurt? All the things, right? So was definitely anxious, but Dr. McGrath put me at ease. It went way better than expected. There's a little pain at the beginning, but once my head was numb, it wasn't too bad at all, and was very excited about it by the end of the day, thinking if this works, this is going to be amazing. They give very thorough instructions, so you're able to, follow those. And 3 months in, you're starting to see hair there. And then 6 months in, you're seeing more and you're getting excited. And, the fact that, it takes 12 to 15 months is pretty wild. But by then I was ecstatic with the results. The second time, Dr. McGrath said that he thinks that FUE was going to be the better option. I agreed, especially since we were going to clean the scar up from the first one. And I said, well, great. Can I just do this without shaving my head again? And he said, unfortunately, no, we're going to have to shave your head. And I was like, oh, no. But, to me, it was worth it. I had already seen the results from the first time, so I decided, all right, shave it. So we had a good time in the office that day, shaving my head. My wife seeing my head bald for the first time ever. This procedure this time, as far as the healing of that was much easier. The FUE just seems, it does make your back of your head look strange for a few days, but then it heals up and it's really, you don't have any kind of scarring that is noticeable. And then it starts growing back again, and even better over the next 12 months. People tell me all the time, man, how do you have such a good hairline? And I'm like, it's called surgery. And they'll get a kick out of it, because I don't mind telling people, because, if it's something that they need, I want them to have that same experience, because it's nice. It gives confidence. It gives the thing that might be helpful to you. And when you're in photos or in something where you're just like, I just want to look better. And I feel like it took 10 years off, if not more. So super happy with the results.